Hello, welcome to part 47 of Clinical Physiotherapy MCQ series. Here we gon discuss day-to-day clinical scenario with detailed explanation. Now don't waste our time, let's move to question number 231. In treating a patient who has had recurrent anterior shoulder dislocation, a physical therapist should avoid which of the following extreme shoulder motions? Option A, adduction and lateral, external, rotation. Option B, abduction and lateral, external, rotation. Option C, hyperextension and medial, internal, rotation. Option D, abduction and medial, internal, rotation. And the answer is Option B, abduction and lateral, external, rotation. Explanation for this question is, the mechanism that creates an anterior dislocation of the shoulder is forced abduction and lateral, external, rotation of the shoulder. This frequently results in a tear of the anterior portion of the capsule. Abduction and lateral, external, rotation may subject the patient to recurrent subluxations and/or dislocations and should therefore be avoided. Now let's move to question number 232. A 95-year-old has recently been admitted to your skilled nursing facility following a fall-related injury, fractured hip with open reduction, internal fixation. Since she lived alone on the second floor, she was unable to return home. She is extremely agitated over her placement here and demonstrates early signs of dementia. She tells you, "Leave me alone, I just want to get out of here." An important approach to take while working with this client is to Option A, be calm and supportive, using only 1 or 2 level commands. Option B, establish the rules, tell her exactly what she is to do while you are with her. Option C, use gesture or sign language to communicate with her. Option D, promise her anything as long as she gets up and walks for you. And the answer is Option A, be calm and supportive, using only 1 or 2 level commands. Explanation for this question is, an agitated patient with dementia does not process information easily. A calm and supportive approach with low-level commands, 1 or 2 actions, provides the best approach to take with this patient. Now let's move question number 233. A patient is recovering from a broken tibia and has just been instructed to discontinue use of a walking boot. The patient demonstrates excessive pronation and complains of pain and instability in the ankle while ambulating. Which of the following is the most appropriate treatment? Option A, begin a single leg standing program and advance to eccentric calf strengthening as tolerated. Option B, begin with open chain exercises and progress to closed chain strengthening of the ankle as tolerated. Option C, begin with closed chain exercises and progress to open chain strengthening of the ankle as tolerated. Option D, begin a strengthening program involving primarily ankle everters, progressing as tolerated. And the answer is Option B, begin with open chain exercises and progress to closed chain strengthening of the ankle as tolerated. Explanation for this question is, progressive strengthening of the ankle will be the most appropriate treatment, while option A, this is a good answer, but not the most correct. And option C, this answer is backwards and not the most appropriate. And option D, this may be a part of the program, but is not the most appropriate treatment for ankle weakness after discontinuing a walking program. Now let's move to question number 234. A physical therapist is testing the deep tendon reflex of a patient as shown in the photograph. The patient has a partial nerve injury of the tested nerve root. Which of the following reflex grades is the therapist most likely to find in the patient? Option A, 0, option B, 1+, option C, 2+, option D, 3+, and the answer is option B, 1+. Explanation for this question is, a grade of 0 indicates complete severance of the nerve. A partial nerve injury causes a diminished reflex grade, which is graded as 1+. A 2+ grading is normal. A 3+ grade indicates an upper motor neuron lesion, not a peripheral nerve injury. Now let's move to question number 235. A 12-year-old male athlete is being evaluated by a physical therapist. The patient reports pain with running and has a sharp pain over the patellar tendon, particularly on the tibial tubercle. Which of the following disorders is most likely present? Option A, leg calf Perthes disease. Option B, chondromalacia patelli. Option C, Osgood-Schlatter disease. Option D, pairs anserine bursitis. And the answer is option C, Osgood-Schlatter disease. Explanation for this question is, Osgood-Schlatter disease is characterized by a painful bump over the tibial tubercle and pain with sporting activities. This is most common in young children who are very active in sports, particularly males. While option A, leg calf Perthes disease is characterized by loss of blood supply to the head of the femur and subsequent bone death. The cause is often unknown and typically occurs in boys from 4 to 10 years old, and option B, chondromalacia patelli are characterized by cartilage loss or disturbance underneath the patella. This is evinced by pain with knee motion, but not a painful tibial tubercle. Option D, pairs anserine bursitis is characterized by pain at the insertion of the sartorius, gracilis, and summitendinosus, which is medial to the tibial tubercle by 3 to 4 centimeters. So, that's all for today. If you have any doubts, please comment below. I think you have learned something valuable today. See you on the next part, that's part 48. See you till then, bye bye.